Chapter 2 is all about using evidence through collaboration to promote excellence in nursing practice. And we start with 5 different levels of collaboration. And we're going to talk about the individual level, which would be at the individual bedside, the organizational level, how evidence-based practice is integrated within the organization, at the regional level, which looks at how we look at accessing evidence-based practice, and we typically use, with the regional level, we look at like using a library. We have the national level and then the international level. So these are the 5 different levels of collaboration. And we'll start with what I think, because I'm probably biased, but I think it's one of the most important levels is actually the nurse at the individual nurse level, because we play an integral role in advancing evidence-based practice. Although it does take a team approach, and we look at this through not only our team with where we work, but at the organizational level, we really have to have our own set of skills in order to advance evidence-based practice, because we need to recognize that our practice is based on evidence, that nursing is actually a science in that aspect. We identify clinical issues, education approaches, and implementing strategies as an example of contributions that nurses make toward evidence-based practice. We really are an important link between research and the point of care. We are clinical experts, and we know how to access the resources that are on the units. We act as change champions, and in order for implementation to be successful, we become the adapters of evidence-based practice change. And in fact, some organizations provide performance criteria for promoting best practices. When we look at evidence-based practice, one concept or one model that is used is called the translational research model, and that is actually applying the research into practice. And this really happens at the individual level. Nurse researchers can come up with evidence-based practice and practice change models and research that demonstrates the best way of doing something to better patient outcomes. But if we don't apply research into practice, all of that is for naught. Some of the examples that we use for translational research is when we have policies and standards, we actually put the evidence base within that policy and standard. So we document where that policy change came from. We modify medical records or electronic documentation. An example is could be the integration of the Braden scale within electronic medical documentation. We know the Braden scale is evidence-based. It is a way to look at skin breakdown and how we adapt our care based on the Braden score. And it's right in the electronic medical record. For translational research to work, we need to have support of education from senior administrators. It is always expensive to have a nurse just on staff for practice change and as a nurse educator, but it is important with evidence-based practice. And we also orient new staff in our travel nurses as well. At the organizational level, healthcare systems are finding that they need increased time to identify practice change from the research and as well as implement it. When we look at healthcare organizations, there should be a vision of providing excellent nursing care, but in order to do that, there needs to be an infrastructure that accommodates evidence-based practice and embracing a culture of evidence-based practice. If you look at the University of Iowa's mission statement, they say that their mission statement is to provide safe, high-quality patient care based on a strong commitment to clinical expertise, education, evidence-based practice research, shared governance, leadership, and collaboration. So a nurse looking for a job would expect that there is a commitment to evidence-based practice from the University of Iowa hospitals and clinics. Um, Other factors that build a culture for evidence-based practice include setting performance expectations for nurses, integrating evidence-based practice into governance structures, and providing recognition and rewards for those nurses who are actually practicing evidence-based or involved in research. At the regional level, um, really looks at how we collaborate to promote the advancement of evidence-based practice. Um, there are different websites that are used as resource centers. University of Texas at San Antonio, University of Iowa, Arizona State University, and University of North Carolina all have websites that promote the sharing of projects that are related to evidence-based practice so that other nurses who are involved in identifying a potential research question, I wonder if it would be better if we did X for patients with Y. They can go to some of these research websites and look and see what research has been done. At the national level, a lot of evidence-based practice has come out of initiatives that have been developed at the national level. Some of the big one is the Agency for Healthcare Research and Quality, National Institute of Nursing Research, the Oncology Nursing Society, American Heart Association. All of these national levels have an area for nursing research to look at best practice, what is the research out there. So when you're looking at a research question, you want to go to these agencies as well to see what is out there that they are have found gaps in the research or what they have found. And then at the international level, we have the Cochrane Collaboration, which is a compilation of many different research studies into one database. Sigma Theta Tau and the Joanna Briggs Institute are excellent resources where you can find research that is done globally as well to look at what nurses are doing in other countries to promote evidence-based practice. When we look at research, we always want to keep it ethical. Human rights are freedoms, and when individuals have rights, others have obligations. So every individual has the right within research to participate, to not participate, and it is up to us as nurse researchers to honor those rights. We have the international and national factors for conducting ethical research, and I alluded to this in chapter 1. There's the Nuremberg Code, the Declaration of Helsinki, Informed Consent, American Nurses Association, and the ANA Guidelines for Ethical Values. And these are all integrated within research projects to make sure that we are not doing any type of unethical research. The Institutional Review Board is critical to understand that any time that we do research, whether it's in our institution, wherever that institution is, we have to have permission to do research. And it is actually a review board that reviews the research proposal to make sure that the research is ethical and that the subjects are treated with respect and we don't do anything that would harm them and that they have full disclosure. There's also the Belmont Report, and the major principles within the Belmont Report are that the research indicates that there's respect for persons, beneficence, and justice are all factored in. Respect for person is based on two different ethical convictions. The individuals are treated as autonomous and they have the ability to make decisions. And any person with diminished autonomy They're also considered vulnerable population or vulnerable subjects. Um, they are entitled to protection. So anytime you do any type of research on a vulnerable population, there are um, there are additional elements to that research that must be considered um, because they are entitled to protection. Beneficence is the principle of doing good, so that the research that is done is to do no harm. So we don't set up a research study to, to that would harm one group and maybe promote the health of another group. And if there's a research study that is going on and it becomes apparent that that one group is being harmed with the research, that we are seeing great benefits by using drug X um, to for whatever reason, but those who are not receiving drug X are actually getting worse, we have to stop that research. We maximize possible benefits and minimize any type of harm. That is beneficence. And then justice is concerned with equality and fairness in the distribution of burdens and benefits. That we treat everybody equally. And when we put people into groups, we don't put them. We do that on an equal basis. We have ethnic minorities or institutional individuals. We want to make sure that they're not selected for studies because they're easily available, and we have to be fair within the distribution of burden and benefits. The subjects cannot receive anything less than the standard of care. Okay, back to the IRB, the Institutional Review Board. Um, this is um, the IRB is responsible for approving any type of research. Wherever you are working, there is some type of IRB in place that will review the research before it can be done. It does not include research involving animals. Food and drug testing is done through a different organization. And the only type of IRB approval you need is if you don't need IRB approval if you're not researching human subjects. There's two kinds of review with the IRB. Full review is necessary when any type of vulnerable population are involved or when the risks are not minimal. In other words, some type of harm can happen within that research. Expedited review is used when there is minimal risk to the human subject, and this is when we're just doing like data review, where we go into a chart. Let's say somebody has been discharged and we're doing a review into the chart to see, or whatever, there's no harm to that subject. So an expedited review would be appropriate in this case. So some examples for an expedited review: collection of hair and nail clippings. This is not going to harm anybody. Um, Voice recordings, existing documents. Remember that as an individual factor, the nurses are patient advocates. The American Nurses Association has charged us. This is our role, is to be a patient advocate. So we must be familiar with the international, national, and organizational standards in order to be a patient advocate. We have to recognize that just because somebody has IRB approval does not guarantee that ethical dilemmas will not arise. So if we observe any type of ethical behaviors, they need to be reported to the chairperson of the IRB, because remember, anytime we're doing research with any subject, there has to be some type of IRB approval.